Every year, thousands of otherwise healthy people die alone, not from an illness, not from an accident, but from a risky behavior most of their family members never knew it existed. Today, we're talking about something uncomfortable, but it's necessary. It's a behavior that is far more common than people think, yet almost never discussed openly. And what is it? Autoerotic asphyxiation. Have you heard that before? Hi everyone, welcome back to the channel. I'm Dr. Wumi, a family physician and a wellness educator. This is not a sensational video, it's a life-saving one. And my goal today is simple. It's to educate, to clear misconceptions, and to prevent avoidable deaths. No judgment, no shaming, just honest, medically grounded information. What is autoerotic asphyxiation? Have you heard about it before? As someone talked about it before, you've seen it on social media. Autoerotic asphyxiation refers to intentionally reducing the brain's oxygen during sexual arousal. It involves breath holding or applying pressure to the neck in an attempt to intensify physical sensation. People who engage in this behavior, they rarely see it as dangerous. And why? They believe they are still in control. They think they can stop when it becomes too much. And they also underestimate how little oxygen it takes to lose consciousness. They assume they can revive themselves if something goes wrong. But physiology doesn't work that way. Why do people do it? They think it feels good. From a medical perspective, oxygen deprivation can momentarily alter brain chemicals like the dopamine, endorphins, and adrenaline. So when it does this, this brief surge can intensify sensation from the individuals and they feel good about it. But here's the truth. There's the line between the temporary sensation and the irreversible brain injury is less than a few seconds. And the body doesn't give us adequate warning before crossing that line. And this is the real danger. First, sudden loss of consciousness. What does it do to us? When oxygen drops, a person can pass out without any notice, even realizing that it's happening. Secondly, there's no ability to remove the pressure. Once one loses consciousness, can't signal the arms or the hands to release whatever is restricting breathing. Thirdly, irreversible brain damage. When it happens, the brain begins to suffer injury within minutes without oxygen. And number 4, it can lead to cardiac arrest. Low oxygen can cause a trigger of irregular heartbeats that we call fatal arrhythmias. It's often a behavior that happens during solitary behavior when nobody is there. What does this mean? No one is present to help. No one can call 911. No one can loosen anything or provide CPR. This is why accidental deaths are tragically common and often unexpected. A critical point that everyone should know: most deaths are not intentional. It's not that the person wants to commit suicide. They are accidental. The individuals almost always intended to stop before anything went wrong. And that's exactly why public education is very, very important. And why is it important to talk about this? Parents, partners, caregivers, and young people need this information. Many discover this behavior online, maybe when they're trying to check or are ways for them to have improved arousal, but they don't understand the physiological risk. They underestimate how quickly harm occurs. But shame or secrecy prevents people from seeking audience. Silence doesn't make people safer. Education does. If you know someone or you yourself are struggling, this is not an issue of morality. It's an issue of safety. So if someone is engaging in this high-risk behavior, you might need a mental health professional to help. to explore underlying factors. A physician, your healthcare provider, can also provide guidance without judgment. Confidential support is also available. Your life and your health really matters. This is very important. Autoerotic asphyxiation is often hidden, misunderstood, and minimized, but the medical risks are very real. And my purpose, like I said earlier, isn't to shame anyone, it's to prevent harm and encourage open, honest conversations about behaviors that can cost a life. If you found this video helpful, please like, share to raise awareness, subscribe for more evidence-based health education. Remember, knowledge saves lives. Thank you for watching. Until another episode, stay healthy, stay safe.